All right. Hey, everybody. I'm super excited to introduce my friend, colleague, mentor to many, and Community Education Group has, worked with the Centers for Disease Control and Prevention over the years. But I gotta say, it never had a better steward of its HIV programs than Dr. Eugene McCray, who I think got the science but also got the community as well. So I'd like to introduce you to Dr. Eugene McCray. Dr. McCray, will you tell the folks what your original title was and how you kind of transitioned through, or traversed actually, through the Centers for Disease Control?
Sure. So thank you, Toni, for that very nice introduction. I'm always humbled when you introduce me. But my last title at CDC before I retired was director of the National HIV Program. It's the National HIV Prevention Program. And I was that director from 2014 to towards the end of 2020 when I retired. But before then, I served in a number of international roles. I was the first director of the Global AIDS Program at CDC, and was responsible for establishing, CDC presence in 29 countries around the world. That I retired from there in early 2005, and then later became the director of the International Tuberculosis Program, and worked with the World Health Organization and many tuberculosis organizations around the world. So, and then in 2014, of course, came to the domestic program.
I don't think I knew that you established the program. I think so there was no global HIV program before you got there?
The history is this. I mean, 1999, President Clinton had provided about $29 million to establish something called the, what was it called? The LIFE Initiative. It's called the Leadership in Investment in the Fight Against AIDS. It was a LIFE initiative, a fight against the epidemic, and that money was primarily targeted to be targeted to 14 countries in Africa and the Caribbean. And so I was asked to come in. Dr. Helene Gale, who was director of the center at the time, asked me if I would come in and help them get this program off the ground. And so I moved over in late 1999 on a detail, and then in 2000 was selected as the director.
Where were you before that?
I'm a tuberculosis man.
Okay.
I was doing domestic tuberculosis, but in my role as the director of the National Tuberculosis Surveillance Program, I did a lot of work in Africa with the World Health Organization doing surveillance work. So I was a surveillance expert.
Oh, and now see, I'm really old, right? I'm 62. So, do you still check for TB with the little sticky thing,
No,
and the thing pops up
not.
on your arm?
No.
Do you remember what I'm talking about?
Yes, I know you're talking. The time test is what we call it.
What is it called?
The time test.
Time test.
We don't know. That's archaic. We don't do that anymore.
That's the only way I ever remember being tested for TB is that they would stick the little thing, and it was like
a little prong.
Yeah, and they were like, if it pops up,
Yeah.
Right. And so, how do you test for TB?
There's a blood test that's a much better test. It's more specific, and you can get the results very quickly. So, and it's very accurate.
Is TB still an issue?
TB is still an issue,
globally,
especially in developing countries.
Okay.
And in the U.S., it's primarily an issue in some low-income communities and immigrant communities, especially black males, older black males, and then, of course, people from countries where there's a lot of tuberculosis, like Mexico, Vietnam, the Philippines, etc.
What causes TB? I don't.
It's a bacteria.
Okay.
And it's airborne.
Okay.
When people get tuberculosis, they usually get it in the lung. They cough, and they're able to spread the disease by coughing. If you're in a room like this, and there's 10 people in this room, and you're coughing, and you have tuberculosis in your lung, and you're coughing, 1 out of those 10 people are going to get infected.
Wow.
Wow. Yeah, so tuberculosis can be very contagious if it's in the lungs.
Okay.
But there's other forms of tuberculosis.
But can we take a vaccine? How do we prevent
it? There is no effective vaccine for tuberculosis. There is a vaccine that is available for high-risk children, young people, young children, like under the age of 2, and that vaccine can be effective in preventing them from getting disseminated tuberculosis, which is what young people get because their immune system is not fully developed. Right. But that's not used in the U.S. at all because the incidence of tuberculosis is so low here. But they do tend to use it sometime in developing countries where there's a lot more tuberculosis.
Right. Now you said that you retired, but the word on the street has it that you have 3 pet projects. I tried to get to be one, but I ain't. So I heard that you have 3 pet projects. Do you want to talk about your pet projects?
Well, I'm not sure I would describe them as pet projects. They're
I
both
would.
they are important, and they got to me before you did. But anyway, so after I retired, I had to spend like 18 months sort of in hiatus, for 12 months at least in a hiatus. So, but so I'm doing 3 things as you said. I'm chairman of the board for an organization called AIDS United that's located in Washington D.C. It has 3 basic functions. One of the biggest functions is policy and advocacy work. They have a national PPC, Public Policy Council, and they are involved in developing policies and evaluating policies for that affects people living with HIV and people at risk for HIV, as well as people with substance abuse and other mental health issues. And they do advocacy on the Hill and regularly, but once a year they do something called
AIDS Watch.
AIDS Watch.
Yep.
Yes, and where they bring in people from all over the country and they meet with their representatives to talk about issues that are important to us, and actually advise them on legislation that may be forthcoming or legislation that's needed to help improve things. The 2 other areas that they work in is the capacity building, primarily to nonprofits, mostly LGBTQ and HIV organizations, and then they do grant making. Again, most of that grant making is to nonprofits, mostly LGBTQ organizations, and harm reduction organizations, et cetera.
And I know they also have a program where they fund organizations in the South. That's
right.
one of the things I want us to talk about, because I know your 3rd organization is Gabe's group, True Evolution, out in, it was your 2nd group actually, True Evolution out in San Bernardino County, which is technically a rural county.
That's right.
All right, and I just think that the work that Gabe's doing out there is just fascinating. And that campus is one of the most beautiful things in the world. So you want to talk about that?
So yeah, True Evolution is again a small nonprofit in Riverside County, and they service all of Riverside County, San Bernardino County, which is very rural. There's a lot of drug use, a lot of homeless youth. Mostly, many of them are LGBTQ youth. So that campus that they have is really meant to be a home for LGBTQ youth. No one is excluded, but it's primarily focused on LGBTQ youth. And they provide a variety of services from mental health to job placement. Housing is the big part of what they do. And you mentioned they have the 4 houses that can house at least 40 individuals. And it's always full to capacity. And then they also now have a strong mental health services, and then now they have putting in place clinical services. So people will be able to come and do what we call one-stop shop, where they can come in, and if you are HIV positive, you can get taken care of for your HIV. If you're at risk for HIV, they have strong prevention programs, there's access to PrEP, et cetera, et cetera. So it's really a good program, and it provides a huge service to a very rural area where there isn't much for young LGBTQ people. And
your 3rd baby is what?
It's a local organization here in Atlanta. It's called Villa International. And Villa is, again, a housing organization that provide housing for people coming from developing countries to study at Emory or to work, to do short-term assignments at CDC, mostly training assignments. And that Villa has been around for a long time. When I was doing my global work, we would oftentimes bring in folks from the countries that we were working in, and they would spend a year here either getting a master's or getting some training at CDC or Emory, and Villa is the place that would house them. So one of the things I wanted to do when I retired was to see what I could do to help make sure Villa remains a viable option for people coming from developing countries who want to study and work in Atlanta.
I mean, one of the things that I think I've always admired about you and enjoyed about you is your ability to pour into other people. Not everybody does that, right? You have what we call a big job, or had a big job. But I always saw you as a person that no matter that job, that you gave back and you took time. I also say that you and I've been around a long time, and many people that I know don't have what I call as a visual acuity for AIDS. They don't remember HIV or AIDS from the 90s, probably because they weren't here, but also from the late 80s to early 90s. And Kaposi sarcoma, wasting syndrome. Some people don't even remember folks having what we used to refer to as buffalo humps, and that sort of thing. They don't remember that. We're now in this era of long-acting injectables. We are in an era of a biomedical response. Help me explain to people why HIV is still important, why it's important. I now work primarily in rural communities and substance using communities. I have to get them to come into the fold. So help me explain to the world and to the country why HIV has not gone away.
Right. So let me just first say that HIV is definitely still a problem, and the biggest challenge we have right now is the lack of awareness. People, I can't count on one hand the number of people just in the last 6 months that have said to me, "Oh, is HIV still a problem?" And these are people who are bright people who are out there and sexually active, etc., that think that HIV is no longer a problem. So we have a lot of work to do to really increase HIV awareness, especially in young people, because they've never seen what we saw. They've never seen someone who was dying from HIV, who had capacities, who had the buffalo hump, as you said, who had wasting. They've not seen any of that. So to them, HIV doesn't exist anymore because nobody looks like they have HIV. The positive thing is that the treatment is there is effective treatment. We know that if somebody is diagnosed with HIV, they get tested, they diagnosed with HIV, they get treated, they get virally suppressed, they will remain healthy and they will not transmit the virus to any of their partners. Similarly, we know that if you are HIV negative, you can get access to services, PrEP. There's now, you can do the pill, there's long-acting PrEP, there's the 2-month injectable, there's a 6-month injectable now, and soon there will be others. So the treatment, and that's what I think has happened, is that with effective treatment, with effective prevention, people are not seeing the HIV that's out there, but it's out there. We still know that there's probably about 1.2 million people living with HIV about 400,000 people or so living with HIV who don't know they have it.
Right.
Yeah. And so it's still a problem. And then there's a lot more people that are at risk. About 1.2 million people we think are at risk for HIV and could benefit from PrEP, but many of those people are not getting it. And the reason, I think, is because there are many reasons. I mentioned the lack of awareness, but the other one that I think that we still, and I hate to be saying this today, but there's still a lot of stigma out there.
Stigma around sexual orientation, or stigma around the disease?
There's both. The stigma around sexual orientation, especially in the South and in certain communities, in my community, in the Latino community, Latinx community, there's still stigma around just being LGBTQ. And then there's even more stigma around HIV, because people think that if you got HIV, you're a bad person because you've been doing something that you shouldn't be doing, et cetera, et cetera. And so that stigma will prevent someone who is at risk from seeking out PrEP, because if they are having to take a drug to prevent them from getting HIV infected, they must be doing something that society doesn't agree with. They're either doing drugs, or they're having sex, or they're with another, it's been men, same thing, etc. So,
well, I want to talk about that. I want to delve into that a bit, right? And I want to delve into it for two reasons. One is that anyone looking at this sees two black people talking about HIV, right? And so they say, well, is it just a black problem? And I want to talk to you from the perspective, most of my work started out in urban environments, but now it's very rural, very rural and very white.
Yeah.
Very rural, very white, and what we see is more substance use disorder than anything else, right? And so we see this decline in fatal overdose deaths, right? Or fatal overdoses, and deaths would be redundant, but fatal overdoses. But now what we see is an increase in HIV and Hep C cases amongst the same populations.
That's right.
Let me give, so you're a scientist, so let me give you some numbers. We just did a testing event 3 weeks ago at an event called Healing Appalachia. 25,000 people, one of the, if not the largest open air country western events on the East Coast, right? Wonderful organization, partnered with us to do HIV testing for the first time. We sample tested 141 people, 2 reactive for HIV, 14 reactive for hepatitis C, and we are waiting on some additional data on the STIs. So those, all that were tested were white, all that were tested were from somewhere within a 200-mile radius of where we were, which was Boyd, Kentucky.
Right.
We were in Boyd, Kentucky. So help me tell people what the next priority is and why we need to think about rural America as maybe that front line. See, because I believe when we keep talking about we can't find somewhere between 20 to 24%, depending on who you talk to, of new HIV cases or existing HIV. I think that they're sitting in rural America, and I think that they're sitting in populations that we don't talk to.
Right. No, I would agree with you that we have a significant problem with the rural epidemic of both HIV and hepatitis C. And what you're describing in West Virginia probably could be replicated in Riverside County, where, again, substance use is a major issue. And when you go to rural some of these rural southern communities just here in Georgia, same thing. But and then the other thing I would say too is that, you know, and a lot of those people are not people that look like us. They're white.
Right.
But the common thing that we all have is poverty. That those people are poor. They don't see a future, and many times because of that, they get engaged in drug use. So yes, the substance use in rural America is a major problem, and that is what's going to be driving the HIV epidemic as we move forward. But my biggest concern now is that with the further stigmatization of those communities, the loss of access, which will happen as a result of some of the things that are going on right now, the problem is going to continue to grow. And I fear that 10 years from now, we're going to have a major epidemic of HIV, hepatitis C, and other STIs in rural America. And it will go unchecked because there will not be services available to people, because hospitals are closing,
Correct.
Clinics are closing. And in the South, things are going to be magnified because of the lack of Medicaid expansion. And so I'm feeling very pessimistic about the future.
Well, and I want to kind of come to that, right? Because what we're in a place where we've had cuts at the Centers for Disease Control, and people sometimes stop at the Centers for Disease Control, but it's and prevention, right? So I keep arguing with folks or discussing or debating the fact that I believe that the value proposition of an HIV test in the United States of America has substantially changed. Why? In part because CDC used to pay for testing. CDC paid for the organization, paid for the staff, paid for the testing unit, paid for molecular surveillance, paid for you to get your confirmatory testing at a state health department. A lot of those resources are gone.
They're gone. They're gone.
So how do we test in the United States of America now?
Yeah, I think there are opportunities, and some of those opportunities really are looking at businesses that are in those communities and that benefits from those communities. You know, they have products and so forth that they say, we've got to get businesses more involved. The other thing is that with this administration, religious organizations are somewhat acceptable. We need to get them more involved in things like testing and so forth, and hopefully, but the challenge, as you say, will be getting the test to them and so forth. But there are things that I think can be done, but I think it's going to be a very tough road.
Right. So, you mentioned this administration, and many people don't know that the Ending the HIV Epidemic initiative was under President Trump's first administration.
That's right.
And was actually one of the things that was going to roll out and rule America. And I think it was supposed to be in 3 phases overall.
That's right.
Only phase 1 was implemented during his first administration. And I believe that they've re-put those, because at first those resources were removed from the budget. Now they're back in the budget. But I don't know. I mean, when I say I don't know, what I don't know is whether or not it will be enough to do the job that we have, and that we have, particularly in rural jurisdictions.
Yeah, but you're absolutely right. I was there and a part of the architect for the End the Epidemic initiative. Yes.
Okay.
And so you're right. It was supposed to be done in 3 phases, but let me just make a couple of points. One, the funding was never adequate to even do phase 1 effectively, but we have data from from phase 1 to show that it was very effective in reducing HIV infection in the U.S. But I think I see that being reversed now. The money, we never got to the phase where money would be going to, where significant funds would be going to the rural area, and that's because it was never funded. The money that's currently in the budget isn't close to what we need to continue this epidemic. But the problem is, ending the AIDS epidemic resources were additional funding to the existing prevention funds.
Got it.
With those funds gone,
it's like, so the EHE funds, what you're saying is that the EHE funds, Ending the HIV Epidemic resources, can't supplant the money that we also lost in other prevention areas.
Exactly.
Got it now.
When you don't have that base there, having the additional impact that EHE would have is gone. And I'm not sure it will have much of an impact at all if those core prevention funds are not there.
Well, I mean, then I'm going to go to the next question. And that next question for you then is because I keep arguing also that pharma cannot bail us out. I think a lot of folks are waiting on pharma to write us a big check. And I don't think it's just pharma, right? I think that this response has to be one around economic and workforce development. Those folks in our case, those folks on Main Street. Because I don't think it's who we think it is. And I think we got to think about who's going to be the person that's the waitress, the dishwasher, the person that's moving the car. Because I think it's that baseline worker rather than us just thinking it's a person in an urban environment. And so help me say to people, who should we be looking to?
Yeah, I mean, I sort of alluded to this a minute ago. Pharma certainly is a big help, but I agree with you completely. Pharma is not the answer. I think it's in the interest of every business, be it a small business, medium-sized, large business, to really think about their employees and how HIV, substance abuse, mental health affects them, and there needs to be resources made available to do that. We cannot rely on the government anymore, and I think that's one answer. And I think also we've always looked at churches. Churches can continue to play a major role, but the churches will never have the resources to do what needs to get done unless they're getting those resources from the federal government, right, which could happen. But businesses, I think, is where we need to be looking. And how do we get businesses engaged? Part of it is education and getting out there and having them understand what's going on in their community and in the people that both work for them and the communities that they're in. And we've tried this a lot in the past, but when the government was funding HIV at a high level, at a certain level, businesses didn't see it as their responsibility. But I think that has to change, and we have to help them change. We have to help them change that.
Okay. So, we've talked a lot, and I want to kind of close out the first section of this with If I was walking down the street and I bumped into President Trump and I had to do the ask, I had to do I got 10 minutes, okay, I got 10 seconds probably to do the big ask of, Mr. President, I need you to, and it's not going to be fully fund EHE, I need you to expand EHE. What am I going to tell him?
Are you just talking about EHE?
You tell me, because maybe EHE now needs to encompass a whole bunch of other stuff.
Yeah, if I had, and if the focus is on HIV prevention,
HIV prevention, education, treatment, and cure.
I would say that we need to rethink HIV, how we are managing HIV. We need to treat every person that is at risk or with HIV as an individual and make sure they have the services they need to keep them from getting HIV or to remain healthy if they have HIV. And what does that mean? That means having a neutral status approach to really dealing with HIV, so that if I walk into a clinic or hospital and I do an HIV test and my HIV test is negative, I need to have somebody talk to me and find out what my risks are. Am I homeless? Am I a drug user? Am I what? And those things need to be taken care of regardless of my status. Mm-hmm. So having this sort of comprehensive approach to management of HIV and prevention of HIV and treating it as I say, a status neutral approach is important. And so I think that, and I would also say that the money majority of the funding shouldn't be going to government. Mm-hmm. It should be going to community, the people who live and work in this stuff every day. I think that's been a problem that we've had in the past. Even though I worked at CDC, I was always concerned about the amount of resources going to state and local health department. I thought that it should be sort of a 50, even more than that, a 60-40 type thing where the majority of money goes to the community, and what the states and local health departments are doing is serving in a supportive role. Mm-hmm. They're helping to collect the data, they're supporting the organization, but the money is going to the organizations that are doing the work. And that would address some of the issues that we have with getting money to rural areas as well.
And so I mean so that's what I would say too. I think it's stat. I always say it this way. I say that you have to give me enough resources where I can take a three-pronged approach. If that person that walks in is in fact reactive to an HIV test, I need to be able to get them access to treatment right away, mm-hmm. and what those other things are that mm-hmm. they may need. If that person has substance use challenges, I need to be able to access treatment for them. If that person is negative for that test, I need to be able to deal with or access all of those things. But I also think that we've really got to frame it around economic and workforce development.
That's true.
That is centered right there. If I can't get you a job after all of this, there's a problem. If I can't get you a house after all this, we still have a problem. So I think that that's exactly it. Taking this sort of approach where we see the whole person. So if I'm walking down the street, or I bump into to the president, or if I bump into somebody in the administration, I'm ready with a status neutral approach and what
economic and workforce development. I think is critical, because that way you're dealing with the whole person as well. Right. Because if they have the economics and they're working and they're able to do things, they can avoid being homeless. They can get the mental health services that they need and many other things. So
right. It's all about access to care and treatment, and I think that we have a tough road ahead, and I don't think anyone can say that there's something different.
Yeah.
Now we've talked a lot about what you did, and what you're doing. But now I want to talk about who you are a little bit. This is going to be the fun part for me, because I always thought also that there were a lot of people, particularly black men, in roles like yours, high level, high profile, really important, official with paperwork and all of that, who didn't talk about who they were really. Mm-hmm. Mm-hmm. Now I happen to know. And I think you're very much out of the closet, so I don't think I'm outing anybody. And I was always really impressed by that. And why do I say impressed by that? Because I think you and I both know a lot of people who are not out of the closet in leadership roles and in leadership positions. And I often say that if you can't be you, and if you can't respect you, how do we expect you to advocate on behalf of other people?
Exactly. Yeah.
I wanted to talk a bit about kind of your journey, and I'm going to say it this way, and I hope you're not offended by the way I'm going to say it, as a young black boy to get to the black man that you are today.
Yeah.
Right? And to the out black gay man that you are today.
Yeah.
So tell me, where did Eugene come from to become Dr. McCray?
Sure. Well, I grew up in rural South Carolina on a farm, and I had a very strong mother. I say that not because my father was killed in a car accident when I was like 9 years old. So I remember him a little, but I can't say that he really had an influence on my life. And my mother, when my father died, she had 6 children, was pregnant with one, and 5 of us, and she had to go to work. We had a farm, but that was not going to take care of us, so she had to go to work. And I think that changed who she was, because she realized that you have to be able to take care of yourself. And so growing up, I have 5 sisters. And growing up, my mother's mantra was, you will go to school, you will study and do well. If you're one of my girls, you're going to college, and we're gonna make sure we do what is necessary for you to go to college. The boys, you're gonna graduate from high school, and you're gonna either go to college or you're going into the military, but you're not staying here. So that was the mindset that we had, and we were fortunate that we were kind of smart.
I mean,
kids.
but you were growing up in the segregated South.
Yeah.
I mean, how old were you? I mean, what year was this? Give people context.
This is in the late '60s, early '70s.
Right.
And even though segregation has supposedly ended, it hadn't ended where we were. I was in an all-black school. I had wonderful teachers and mentors there, and so when it was time for me to go to college, I was well prepared.
Okay.
And I think growing up in that environment, having that sort of, that expectation of black excellence in my school, it made a difference in terms of who I became and where I ended up going. I ended up going to Morehouse.
Okay.
Because that was.
So you're a Morehouse man.
I'm a Morehouse man. My mother, my high school principal, it was like, you're going to Morehouse.
Okay.
So that's where I went. But but the thing is, when where I grew up, what I knew as professionals were teachers. So I was going to become a teacher. And some people have asked me, well, did you dream of ever becoming a doctor? And I look at them and I say, what do you mean dream of? I couldn't dream of something that I didn't know about.
Right.
I didn't know I could be a doctor. So no, I never dreamed of it. I dreamed of being a teacher, but I never dreamed of being a doctor. But when I was at Morehouse, and I think somebody saw in me that not only was I was a math major, by the way. I was studying math. And my mentor said to me, he said, we're trying to get more people in the pre-med program, and I think that you have the right, the right personality, you're smart, I think you would do well, and you should think about becoming a doctor. And that's what happened. Someone said to me, and I said, well, I will do it. So I switched my major from math to pre-med, and then applied to medical school, got in, and...
Where'd you go to medical school?
I went to medical school at the place that gave me all the money, because I needed money, Wake Forest.
Wake Forest, okay.
So a class of 108 people, 4 blacks,
okay,
2 women, 2 men. And I was the only one that graduated in the 4 years.
Really?
The 2 women graduated a year later. They had to spend the 5th year there. But medical school, and as I say, that's why Morehouse prepared me well for medical school. When I got there, I really didn't have any issues with the curriculum or anything.
People may know Morehouse from the Ralph Lauren ad, or from from
Yes.
something, right?
That was not me,
right. Somebody might know Morehouse from maybe a Spike Lee movie or something like that. What is the consummate Morehouse man? When someone says Morehouse man, what do they mean?
Well, the anecdote is, you can always tell a Morehouse man, but you can't tell him anything. So from day one, when you walked on campus, you were indoctrinated with this concept that you were bright, you could do anything you wanted to do if you worked at it hard enough. And that was ingrained in you throughout that 4 years. So you were always encouraged to strive for excellence. If you could make a B in a class, if you didn't want to make a B, you had to make an A. And if you couldn't make an A, you needed to understand why and so forth. And then you had a lot of support. So it was always just strive for excellence.
Right.
And the founder, Benjamin Mays, is like the father of Morehouse, was somebody who really pushed and all of us. And I had the pleasure, unfortunately, when I got there, he was very old and an emeritus, but I had the pleasure of meeting him. But the leadership there and the mentorship there was really something that was just overwhelming and so important in me becoming who I am today. And many of my friends who I was there with that became doctors and lawyers and so forth, we all feel the same way. Morehouse was a special place.
Right.
And it made you feel as a black man, you could do anything in this world.
Yeah, I don't know anybody that I know that went to Morehouse that has said that it was a negative experience. I really.
There are negative experiences.
But in its totality.
Yeah, in its totality.
Not moments.
Yeah.
But in its totality.
Yeah.
And I think even in the folks that have said that, whether it was, and usually the negative stuff I hear is around a particular frat or not a frat.
Right.
And that's some of the negative that I hear. But again, those experiences seem to have been a part of shaping them as men as well.
That's right.
And I think, because I have a friend now who has 2 sons who are at Morehouse now, and I was shocked that they went to Morehouse because they got accepted into 3 Ivies and Morehouse. And they were like, no, we want Morehouse. Now neither one of these kids had ever been at a historically black school or a predominantly black institution. They had gone to private white institutions their whole education. But they said they felt like they needed the experience of Morehouse to prepare them for the world.
Yeah.
How do you feel that Morehouse prepared you for the world?
Yeah, one of the things when I was there is that we got exposed to a lot of folks, former Morehouse graduates, who were doing things around the world, globally and across the U.S. And so you saw people that you could aspire to. You saw some people that looked like you who were in these really important jobs. Oftentimes they were the only one there. And so you heard it, and they would come every week. We had a 1-hour seminar where we'd have people come in and talk to us about their experiences. And that to me was very inspiring. But the other thing was that because there was always this push to excel academically, you felt prepared when you left Morehouse. I mean, for example, one of the things you have to do when you're applying to medical school is take this medical college admission test. And, we all did very well on it because we were prepared. Similarly, when I started medical school, just to give you an example of an experience and sort of the overt race, I shouldn't say overt, what's the right word? Passive racism that you experience when you're going to these institutions is my first day in medical school, we were sitting in anatomy and getting an orientation by the anatomy professor. He looks at the 4 black folks in the room and he says, the 4 of you need to, those of you that went to HBCUs, now I was the only one of the 4 that went to an HBCU. He just assumed that everyone else had gone. You're going to need to get your tutor now because you people tend to have problems in my class. But he didn't know anything about me.
Right.
He didn't know that I had actually at Morehouse, my senior year, took a class in human anatomy, and his class was a refresher for me. So at the end of the year, when he had to give me the award for the student with the highest grade in his class, I mean, you had no idea, you couldn't imagine how puffed up I was.
Right.
Because I said, this bastard.
Right.
And we had been warned
Right.
that he was quite a racist, and he always made the black and Latino students feel, awful, and women too.
Right.
I shouldn't say women regardless of color, because he didn't think we should be in medicine.
Right.
But I've digressed. Let me get back to me as a person. So one of the things that happened when I was at Morehouse, I mean, I sort of knew it before then,
Right.
is I realized I was gay.
Uh-huh.
Now, I had a girlfriend and everything.
You had a girlfriend?
Yes, I did.
Hold it.
Yes, I did.
Hold it. You had a girlfriend?
Yes.
Come on.
Yes, I did.
What was her name? You don't have to give her last name. Just give her first name.
Well, my high school sweetheart name was called Cheryl.
Cheryl. Uh-huh.
Uh-huh. And so, and then we were actually engaged.
Uh-oh.
And my mother was the one that said,
Don't do it.
Don't do it. And she didn't exactly tell me why until I told her later that I was gay. And she said, well, I always knew that you were different. And you're my son. I love you. And just make sure you stay in our lives. Don't go out there and stop
And
being
think
a
you
part
don't
of
have
our
family,
lives. Because
right?
this is family, yeah. Because family for us was really important.
Have you talked to Cheryl? Where's Cheryl? Have you seen Cheryl?
Oh, yeah. We're still friends.
Yeah?
Yeah.
Sure. How many kids Cheryl got?
2.
Okay. All right.
The sad thing about it is that, not sad, I guess the interesting thing about it is that she did get married. And the person that she married ended up being gay, and there was a bad outcome.
Maybe Cheryl's a gay.
No, she appreciates fine men.
Right, exactly. Maybe
regardless
that's it.
regardless of their sexual orientation.
Right. I mean, I get it. She just likes a good man.
Yeah,
but
I was going to say my mother's response to my coming out to her my last year of it's between college and medical school was just so good.
Right.
And she and she said, I don't care, what you do. You're my son.
Right.
We love you, and you are a part of this family, and
Right.
you need to make sure you remain a part of this family.
Right.
Because that was important to her.
Well, now I'm one of of the privileged class who happen to know your husband, and I love your husband because I think your husband is probably one of the funniest people I know on the face of the planet. His sense of humor is drier than my sense of humor, and he what I like about Ben is that Ben tells a smart joke. Ben doesn't tell a dirty joke. But it's dirty, but it's smart and dirty, which is what I like.
Yeah.
So how did you and Ben meet? And was Ben like your first love?
The answer is yes, and I'll tell you how we met. I won't tell you everything.
No, I don't want. This is
so,
PG.
I had just graduated from college, and my best friend in college insisted that we go out. So we go out to this bar in Atlanta called Backstreet, which is a famous bar so we get there. And
what year is this?
This is 1976.
Okay.
On my mother's birthday.
Okay.
When I should have been in South Carolina at my mother's birthday, but I was in some bar and with my best friend. And I realized at midnight, he's disappeared. I can't find him. And there's this man, this bar was sort of it was a mixed bar, but there was a black corner. I don't know if you know about black corners. But in a lot of bars, there's sort of this black corner, a black area where all the black guys sort of hang out and we talk to each other. And this guy kept walking by and looking at me. That was Ben. And after about an hour, I guess he decided it was time that he come over and talk to me, because when I go to a bar, I'm one of these people that I find my spot and I sort of hang out in my spot until I go get a drink, and I come back to my spot. So he knew where to find me. So that's how we met. We met in Backstreet. We started talking, and then we hung out the next day.
The next day?
Yeah, we hung out
You're
all the
fast.
next day. We hung out the next day and that weekend.
Well, okay.
Now the interesting thing is, he was also there with somebody. And that person disappeared also with somebody else.
Okay.
Now, I was with my best friend. He was with somebody that he was sort of dating at the time, but that person ran off with somebody.
Right.
So we met because we were both sort of left there all alone.
Right.
And the rest is history. That summer I was working. I'm here in Atlanta, and he was on a project. He was between the second and third year of law school.
Right, because he's an attorney.
He's an attorney. Yeah,
right.
He was. Yeah, and so he was here on a project, and he would come. He not here in Atlanta, but he was in North Carolina. But he would come to Atlanta every weekend after we met, and we would just hang out. And then eventually, I revealed to him that I was when he was getting ready to come back mid-August. And I said, well, you can't come back this weekend because I won't be. You can come, but I won't be here. We were just sort of dating,
right.
not dating, but just having sex.
We weren't. We'll rephrase that as you and Ben were canoodling.
Canoodling. And so I told him, I said, I'm getting ready to start medical school in a couple of weeks, so I won't be here. I'm going up early to find a place to live and stuff like that. And he said, oh. Why didn't you ever tell me this? Anyway, we had a long conversation about it, but he decided he would come and drive me up to North Carolina.
Okay.
And he spent the time with me there and helped me find helped me find a place to live. I sort of knew where I was going to stay, but he was there, and then we just started dating, and one thing led to another. And when he graduated from law school, he was about to graduate from law school the next year. I was at the end of my first year of medical school. That's when he popped the question about us moving in together. He wanted to look for jobs in North Carolina and move here because he said, according to him, he knew that I was the right person. Right. I wasn't so sure because all I was focused on was medical school. I wasn't focused on a relationship.
Right.
But it was one of the best things that ever happened to me.
What year is this? What year
this is 70. I met him in 76. In 77, he graduated from law school at the end of 77, so he moved to North Carolina at the end of 77, like in May of 77.
But we haven't disclosed that Ben is white.
Yes. Right,
and so and I bring that up only because I'm like, you're in Wake Forest, North Carolina, and you and Ben walk in, and how tall are you?
I'm 6 feet.
How tall is Ben?
5'9".
Okay.
5'9".
Okay. 5'8". I'm 5'6", and Ben and I are eye to eye.
Okay, well he said, I'm just telling you what he tells me.
Ben is not 5'9".
That's what he tells me.
Ben is not 5'9", not on a good day.
Yes.
Okay, if that's what he wants to put on his license, all right. So, was there any blowback for the two of you as a couple?
Well, blowback, yes, in one way. That I had friends from college who had issues with me being in a biracial relationship. And as far as I was concerned, that was their problem. Right. And
so it wasn't that you were in a relationship with a man; it was that it was a white man.
That's right.
Okay.
Because they knew when I came out, I told a lot of my friends, and they either accepted it or they don't. If they didn't accept it, then so be it.
Right.
But I saw it as their issue. But we had problems. Yes, there were times that we would go out to the bars in North Carolina, and if Ben went before me, if we weren't like together, oftentimes they wouldn't ask him for ID, but then they would ask me for ID and say, well, and if I only had one piece of ID, I couldn't get in. Oftentimes you needed two. But they would let Ben in, and the comment they would make to him is, "Oh, we've seen you before," and he said, "No, you haven't, because if I was here, he was here with me."
Right.
And so anyway, those are the kinds of things that it was really interesting. There was a lot of racism that I experienced in gay bars in the South, especially in South Carolina, and even here in Georgia, Backstreet, the place that we met. We were coming back one summer between my second and third year of medical school, and we went to Backstreet. I couldn't get in because I didn't have enough ID.
So one of my big questions is always, and I probably don't talk about it enough, and I can say I've had conversations with other people about it, and nobody ever wants to really talk about it, is that a lot of our leadership in the HIV space, particularly those that are black men, black gay men, are coupled or partnered or married to men who are white. And I think we were talking about you and Ben, and we were talking about how, kind of you and Ben met, but we were also talking about the fact that you and Ben seem to always also have been on the same page. And and I think that some of the kind of conversation is always like well, is there an impact if you are married to a white person or a person who's non-black? Do they get our experience? Do they somehow change your core belief or understanding?
Yeah.
And I mean, because if you think about it, we can look over, the last 40 years and think of some people, and it would be true that there would be a larger percentage of black men with white husbands, partners, etc. But does it matter?
I mean, I don't think it doesn't, and it doesn't. I mean, as I said before, Ben and I had a lot of the same values, but I think part of the part of what happened with me personally is that I think being with Ben helped me to really have a different perspective and enhance the passion I had for doing work in my community. Because I think, if it wasn't for his support, and I'm not sure I would have gotten that in other relationships, regardless of whether it was black or white. I think because of Ben's background and that was different than mine, but we had so many similarities. He was very supportive, and whatever I decided I wanted to do, we talked about it and we made the decision together. But he was 100% in, and so I don't know that I would have become who I was if it, in terms of my career and so forth, if I didn't have him pushing me in the background and saying this is important. Because I would run things by him. I say, am I going to get myself into trouble if I take this on, or tell people at work to go to hell because they're not, and I would take on certain positions at CDC in work groups and things like that because they needed a black person. From my perspective, they needed a black person and they needed a gay person, so that I was in the room so that things could be said that nobody else would say or think about saying. And I was always concerned about whether it was going to get me in trouble. And I run it by him, and he says, it doesn't matter.
Right.
If you don't feel that you can do your job, then you shouldn't be in that.
Right. And I still contend that Ben is not 5'9", not on a good day. Okay, I just want to say that for the record, into the camera. If Ben's 5'9", I'm 5'9". Okay, let me just move that one.
Okay.
Move that one along. I'm not going to beat that point home anymore. All right. So we're getting ready to wrap up, and we are X days into a government shutdown. Yeah. And we are in a place that we've never been before. And what I like to do here is end with hope. Because I think that there's certainly enough things for us to have despair about. When you think about everything that's going on, when you look at the world, at all of its chaos, what is the hope that you give or that you can give? Because I think right now, I always say two things. One is that we need to rely on each other in a way that we never have before, number one. And number two, I don't know what it looks like on the other side, but we'll make it to the other side. So what's your word of hope or words of hope right now?
So let me just say, yes, you're absolutely right. I have concerns, but I'm also I'm optimistic because I've been around a long time and we've dealt with really bad things in the past. One of the things that I think is really, for me, that has been so empowering for our community, for me and the community, is that we do rise to the occasion. I think there are a lot of smart folks in our community that we are putting our heads together, and we're going to come up with solutions, and we're going to find things that are actually working better. I mean, we have the opportunity with all this chaos now to really think about what the future should look like, because we are going to have to really re-envision the future and how we want HIV prevention, care, and so forth to look like in the future. And I'm optimistic that we're going to rise to the occasion. And I think that we will be in a position in the future where we're not as reliant on government.
Right.
And if government is involved, there will be more of a direct relationship with the community than with state and local health department, federal government.
Right.
Yeah.
Right. Well, thank you for taking this time with me. We are going to bring in a friend of yours in a minute, and we're going to give you a little break. But more importantly, I really and truly want to just thank you for your commitment to service to the country, your commitment to service to people who don't even know all that you've done for them. I always have a good time when I'm with you. But I don't know if you know how much I truly just respect you.
Right.
And that I really respect, and I don't want to cry, but I really just respect everything that you've done on behalf, not just of the nation, but of the world. And so many people don't know it, so I hope that this tells a little bit of that story.
Well, thank you.
Perfect.
Thank you.
Thank you so much.